Hello, I'm Dr. David Kwiatkowski, and welcome to this edition of Pet Topics. We're here at Chatham Animal Hospital today in Cary, North Carolina with Cosmo, and we're going to demonstrate cleaning the ears. That can be a very difficult thing to do, especially if your pet's ear is painful from an infection. Routine cleaning is important as well in dogs that are prone to having infections. Some dogs who aren't having any ear problems don't really need their ears washed. You need to follow your veterinarian's instructions as to whether or not your pet would benefit from an ear wash or not, or periodic ear washes. First, I'd like to go over the anatomy of the ear, because oftentimes people are worried about hurting the ear itself. And the thing that we have to remember about a dog's ear, and cats as well, is that the canals are very long. It's composed of something called a vertical ear canal and a horizontal ear canal. At the end of the horizontal canal is the eardrum, and there's the middle ear and the inner ear. When we're putting medications in the ears, we're usually just going straight down like this into the vertical ear canal. So if you think of a medication tube, you're going in just about like so. You'd have to go way like this to hurt that eardrum, but you could hurt the dog if you bumped them in the bottom of the vertical canal just like this. But you're much safer as far as avoiding puncturing the eardrum if you're putting the medication into the ear, if you stay parallel to the head. So that's the idea, that we're going to stay parallel to the head. This side of the model shows an inflamed ear, and the fact that the ear canal gets very narrowed as it gets infected. Discharge forms, wax, bacteria grow, yeast organisms also like to grow down in the ear. And this demonstrates a swelling of the lining of the middle ear, which makes outer ear infections be recurrent. Once an infection gets in the middle ear, it is very difficult to clear it completely. So we try to treat ear infections early so that we can prevent damage to the eardrum and eventual eventual middle ear infections, which can become inner ear infections as well, but the most common in the dog are the external ear canal infections. So in order to clean the dog's ear, you would want to hold the ear flap straight up to create a straight line between the ear canal and the base of the skull here. You take your ear medication, or ear wash is what we're demonstrating today. Hold the ear up and fill the ear canal up. If you hold on to their head, because they're going to want to shake, then if you'll take a cotton ball, put it into the ear canal, and massage the ear. Just like that. Oh, it feels good, boy, huh? Yeah. Yeah, it's a good boy. And once you've massaged the ear, you remove your cotton ball, and you'll see wax adhering to the cotton ball that was washed out by the ear wash. The Cosmo's ears are pretty clean in general. He just doesn't have an infection. If you look closely, that's the way the ear should look. It should be nice and pink, shouldn't be any discharge, shouldn't be really any odor. Odor, discharge, redness, inflammation are all signs that an ear infection may be present. Ear infections are often secondary to something else, and your veterinarian will help figure out what the exact problem is with the ear that may be contributing to the ear infections. Please visit us again another time at Pet Topics. These are instructional videos put on by the veterinarians at Chatham Animal Hospital in Cary, North Carolina. And I'm Dr. David Kwiatkowski. Thanks for watching. Bye-bye.